Hello and welcome once more to this channel, Clinic Wahala by yours truly, Dr. Catch. Last time I talked about malaria and malaria resistance. I believe many of us have seen that one. But today I think I need to mention an even greater problem, which is the problem of antibiotics. These past 2 weeks I've seen a couple of patients who had severe infection and cultures were done, samples were taken, and the bacteria causing the infection showed up in the test results. But something wonderful, something disastrous, not just wonderful, also showed up. And what was that? Usually when we culture organisms, or when we culture a sample, be it blood, urine, stool, culture is to give the organisms inside that stool or urine or blood, to give them the chance to grow, to amplify their growth. That's what culture does. It causes that organism to grow and show forth itself, so that the person looking at the culture sample will now see, so this organism, you're the one responsible for this infection. That's what culture does. But it doesn't stop there. They also take some antibiotics and put on patches of the organism in the culture plate. The essence is, if with time you see that the organism vanishes from a particular place you put an antibiotics, you can say that these antibiotics works against this organism, so this should be one of the antibiotics you will use and treat that infection. I'm just trying to explain it in layman way how the culture test works. So the marvelous thing that happened in the past 2 weeks for 3, 4, 5 patients that we saw and sent samples for culture, they brought out organisms, that these organisms are responsible for this infection. But the sad part is that all the antibiotics tested, not one of them was active against this organism. You may not understand the gravity of what this is, but you know that many people have been shouting about antibiotics resistance and the need for us to do our part to prevent antibiotics resistance. The organisms on their own are smart enough. Every day they are trying to change their dress or the things you use in recognizing them, so that they will evade these antibiotics when you take them. They are trying, they are working at the level of their genes, their chromosomes. They are trying to do things to make sure they can even create things that will help. As the drug is coming, they will just dodge, or if the drug is entering, they will pushing it out so that the drug does not work. They are already working hard. The irony of the matter is that as human beings that God created, we are also working hard for them. Many people are working very hard for them. Scientists are out there trying to create more antibiotics that will beat these organisms if they evade the regular antibiotics we have. And we, the people that drink these antibiotics on this other part, are working hard for the organism by causing resistance. How? You will be ill and you have a fever. You will go to a pharmacy, they'll give you malaria drug, and as if it's not enough, they will add antibiotics. Some will say it's for typhoid. Which typhoid? Who told you that typhoid and malaria are married? They are going hand in hand anywhere they go. And they will not even treat an infection fully. There is a reason why they said for this disease, you treat for 7 days, you treat for 10 days, you treat for 14 days. There is a reason. Because they want to completely clear out the organism in the system so that it's completely dead and cleared. But when they give you for 7 days and you take for 2 days and you feel you are getting better and you throw it away, maybe say that there are 10,000 soldiers of this organism, you end up killing 4,000. 6,000 will be there watching you. Of course, what will they do? The 6,000 will now go and say, okay, this is the antibiotics they use in killing us. Okay, let's go and produce machinery that will prevent these antibiotics from working. And this person infects another person, and the person goes to take the same antibiotics and it does not work. You ask yourself, why? Is it not the same antibiotics? There are many reasons why resistance happens. The companies that produce the drug, I beg, help us. That's another segment. Some people are used to producing fake drugs, fake medications, substandard medications. They will not give the appropriate dose into it. So, but when they now do it, or when they produce the correct one, you now join them by taking these drugs in a very regular way. You don't take it today, you take it tomorrow, you take for a few days and you stop. So that these organisms develop resistance. Now tell me, for those patients that they've checked all the common antibiotics and none works for them, what will be their fate? If they die, their blood is also in your hand, because you are part of those that caused it. So while more antibiotics are being produced to help with the situation, please do not add your own quota to the antibiotics resistance. Complete your antibiotics. Make sure that you get a properly prescribed antibiotics and complete the duration. Don't go and be taking drugs from chemists and from. I've warned you people before. When kasala bursts, people will now come for the doctor to do something. It's good you always see your doctor who will direct you aright as regards these things. Bikono, try and do better. Save this country, save the people therein. Don't do harm, rather do good. Thank you very much. Do like, share and subscribe.